So these ones, these braces here, these are our hinged knee braces. I believe they're called the Warrior brace. So those of you guys, a lot of the time we end up referring to all these ones as Bledsoes, but that's not what this brand is. So these are ones that are really nice for if the surgeons want them to be able to bend to a certain extent, but they don't want them to be unsupported on the sides. So sometimes we would see braces like this for, say, Dr. Khan's tib plateau fractures or distal femur fractures. So it's kind of nice to know how to adjust these. If you can kind of take a look here. So there is, you can see when they come in the box, they usually come shrunk down quite a bit like this. So I've actually pulled this out a little bit. So if you got somebody maybe a little thicker leg, you pull it out a little bit. You're looking at the same basic principles though. These hinges right here, the dials, those line up with the knee. And then we've got, you can see there's a little smaller end here is the ankle end, and the thigh piece is a little bit thicker up top. Okay, so these are this really nice because if you got somebody really short to somebody fairly tall, I believe they told us it was like 4'8", clear up to 6'4", I think. So you can actually extend these out. So I want you guys to take a look here. There's on here, there is a little padlock and an unlock. So if you just try and mess with it when it's on the lock, it doesn't do anything. If you hit that so where it's unlocked, you can make it longer. And once you get the length that you want, you click it back and it stays.
Same at the top?
Yep, same at the top. Yeah, go ahead and play with it there.
And the idea of linking that is to provide more stability to it.
So the same sort of idea when you're looking at the length on the patient, you're looking at, it's gonna hit them roughly towards the groin area, so you want them to be a little lower than that, down to roughly below, around the malleolus. So you don't want them to be riding right on the malleolus if possible, just a little bit above there would be good. So then with Joel, we're gonna just estimate here. Don't want to make this too weird here. Hey, you guys probably couldn't see that from over there. So that little lock and unlock there. So you do the unlock and pull it out. There, you lock it again. There we go. Okay, and then the other thing that you're looking at is, depending on what they put in the orders for what they want the thing to be set at for flexion and extension. On these dials, they actually have them labeled extension on the top and flexion on the bottom. So I was just kind of messing with this a little bit ago. These take a little bit of work to undo. So most of the time, the surgeons will have you at 0 on extension, but once in a while they'll have you do some weird setting like they want it locked at 20 degrees. Okay, how do we do that? So this little guy here, there's a little switch here that you have to, this is always the part I always have to mess with a little bit. So you have to really pull it quite a bit to get that to undo. And then that allows you to unlock and change the settings. So say I wasn't kidding, I was really having to mess with this pretty hard a while ago. Sometimes you have to kind of play with the hinge itself. So you move it a little bit to where, say we're locking it at 20. So I put it 20 there, and then you can move this and hopefully move the switch over to where the 20 is in the window. And then with luck, you can get it to hook back in. This is always where it's tricky on these. You have to line up with the teeth just right. And it's, sometimes you got to play with the hinge itself. So you notice how I kind of moved the hinge and it moved the switch back a little bit. So this is where that gets a little interesting. You have to kind of shimmy it in so it locks. There's these little teeth things in there that these switches are hooking into. So hopefully it won't provoke too much swearing when you have to do it. But once you have it in the setting that you want, it shouldn't move after you're done with it. There you go. I usually hook that other switch back. So you see that's not going to go anywhere. If you have somebody that is supposed to allow some bending, then you would probably set it a little differently. Sorry guys, I swear at these a lot when I have to do them. So say they want him to go to 90. They want them to say, it says like 0 to 90 on the orders. So you do 0 on that, and now it's gonna allow them to go that far.
Yeah. It's good for us to know too, these things are a wrestling match to get set. It's good, because if we're wrestling with it, we think, oh, we're doing something wrong. It's a wrestling match.
It is. The length is easy to do. The setting on the hinge is not so easy. So generally, when you put these on, it's very similar to the knee immobilizers. If you have a really nice, compliant patient that can hold their leg up for you, it's just fabulous. Okay, so then right here we're doing right around his knee. We're getting that dial hooked up around his knee. And then these have these kind of cool little connectors here. I don't know if you guys can see the connectors very well. So it's got this nifty little setup where you got this hole.
Come on.
Yeah, you may want to come a little closer just so you can see, because it's black on black. It's hard to see. So you got these little nifty connectors here that you'll do around this hook. So you kind of do like that, and it kind of clicks back. And then you tighten it. Once you get the tightness that you want, if you have to take it off again, this is all you got to do. So you don't have to mess with the length again.
Nice.
Once you get it right.
Okay.
So then you just kind of go through and hook all these up. So it's a pretty slick brace. I mean, it's really nice for the patients to be able to do. Now you notice the straps are 1.5 miles long.
Right.
They have the ability to be undone and cut. So if you got somebody with a thinner leg and you only need that much strap, you can cut that sucker off and put the Velcro back where you want it. So
Oh,
say
this comes off, yeah.
yeah. So you can, I mean, you can do a lot of tailoring to it. So if you have to put one of these things on and it's looking like, my God, I'm wrapping this thing clear around, you know, you can really do a lot of tailoring to it. And again, if you're not comfortable with doing all this fancy stuff with cutting the straps and readjusting all that, throw it our way.
See
Not a problem.
That, oh, they're like that.
Yeah. There's a lot of the braces that you can do that. There's some of the shoulder braces you can do that with.
And
too.
as we all know, this Velcro is like NASA
Yeah.
approved. I mean, it is.
Yeah.
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 Okay, and then I should be able to. Oh, this one's locked. You get one at 90. And,
See, no, isn't that a lovely instruction there, Joel? No, I'm serious. I walked in on braces like that. Or like, whoops, they forgot to do the other side. They're roughly in the right area. Okay, now go ahead and try.
nice.
There you go.
0 to 90, and it's supporting me for no lateral movement. So that's some patients we have that.